Next comes the peptic ulcer. What is peptic ulcer? The peptic ulcer is a sore that develops in the lining of the stomach, duodenum, that is the upper part of the small intestine or the esophagus. So how will you differentiate a peptic ulcer from a duodenal ulcer? Well, the peptic ulcer they can occur in the stomach or the duodenum, that is the first part of the small intestine, while the duodenum ulcer specifically occur in the duodenum. The gastric ulcer they are located in the stomach, specifically in the lining of the stomach, while the duodenum ulcer they are located in the first part of the small intestine, known as the duodenum. So peptic ulcers they are typically caused by bacterial infection. They are associated with the H. pylori or long-term use of NSAIDs drugs such as aspirin or ibuprofen. Other risks of peptic ulcers are the smoking, excess alcohol consumption, and the stress. So what you will see in the patient with a peptic ulcer, you will see abdominal pain, nausea, vomiting, bloating, heartburn, and the loss of appetite. Some patients may experience weight loss or blood in their stool. So treatment of the peptic ulcers depend upon the underlying cause. So we can give antibiotics to treat the H. pylori infection. We can discontinue the use of NSAIDs, reducing the dose that may be necessary if they are the cause. We can uh, reduce the amount of the acid in the stomach, such as we can give is the proton pump inhibitors PPI or H2 blockers that can relieve the symptoms and promote the healing of the ulcers. So the main difference between the peptic ulcers and duodenal ulcers is lie in the location. Peptic ulcers they can cause burning pain in the stomach that may be worsened when the stomach is empty or at night. The pain is relieved by eating or taking antacids. In contrast, duodenal ulcer they tends to cause pain in the upper abdomen that may be relieved by eating or taking antacids. The pain may occur after a few hours after eating and may also wake a person at night. So both the peptic and the duodenal ulcer they are caused by bacterial infection with the H. pylori and the use of the NSAIDs. So you should understand how H. pylori causes peptic ulcers. So when the bacteria it infect the lining of stomach or the duodenum, they will cause inflammation and damage to the protective mucus layer, allowing the stomach acid to reach the lining, and that acid can cause a ulcer. So H. pylori is spread through the contact with the contaminated food, water, or the objects. This bacteria can survive in the acidic environment of the stomach and can even penetrate the protective mucus layer. Uh, so it may be seen where the sanitization may be poor and access to healthcare may be limited. So how can you diagnose this H. pylori? Through a blood, stool, or breath test. So what is this breath test? Uh, the H. pylori breath test it is a non-invasive diagnostic test that is used to detect the presence of H. pylori bacteria in the stomach. The test is based upon the fact that H. pylori produces a specific enzyme. What is that enzyme? That is urease. So these enzymes would break down the urea in the stomach to produce carbon dioxide and the ammonia. So during the breath test, what a person will do, he will drink a solution containing small amount of urea that has been labeled with a special carbon atom. So if the H. pylori is present in the stomach, the urease enzyme that will break down the labeled urea and produce the labeled carbon dioxide that can be detected in the person breath. So this is all about the breath, the urease breath test. Other test we can do is the H. pylori stool test, also known as fecal antigen test. So what is this test? The test works by detecting antigen that are produced by H. pylori in the stool. So sample of stool will be collected and sent to the laboratory for analysis. The analysis the sample is analyzed for the presence of H. pylori antigens using a kit. If the H. pylori antigens are detected that confirm that a person has H. pylori infection, it may produce a false negative result sometimes if the person has taken antibiotic or proton pump inhibitor that can affect the accuracy of the test. So what should be your goal? The goal should be to completely eliminate the bacteria from the stomach or the duodenum. So what would be the treatment of choice here? You can use antibiotic and medication that reduce the amount of acid in the stomach, like the proton pump inhibitor or H2 blockers. What is the standard treatment for H. pylori eradication? It involves a 7 to 14 days course of antibiotic that consists of triple regimen therapy. So 3 antibiotics we use: amoxi, clarithrol or metronidazole. Twice a daily for 7 to 14 days. Now, what is the virulence factor for the H. pylori? The gene that is the gene that contribute the H. pylori to cause disease is CAGA gene, CAG-A gene. This gene has been associated with increased risk of peptic ulcer disease and gastric mucosa associated lymphoid tissue, lymphoma. So this gene can be detected by the molecular techniques. The techniques are the PCR based assay. Now, what are the surgical treatment of the peptic ulcers? The surgery is generally not the first line treatment for the peptic ulcers, as most the ulcers can be effectively treated with medication and the lifestyle modification. So, however, a surgeon can plan for the surgical procedure for peptic ulcer. The most common procedure that surgeon use is gastrectomy. So during the gastrectomy, the surgeon will remove some part or all the part of the stomach depending upon the location and severity of the ulcers. Other surgical part for the peptic ulcer is vagotomy. So here the surgeon will cut the vagus nerve that controls the production of the stomach acid. So what this acid will do? This helps to reduce the acid secretion that can promote healing of the ulcers. In addition to the gastrectomy and vagotomy, the other procedure a surgeon can perform is pyloroplasty. So what is that? That is done to improve the pyloroplasty will widen the opening between stomach and the small intestine. Or he can do enterectomy that removes the lower part of the stomach where mostly the peptic ulcers occur. Now, important part that you have to remember is what is Zollinger-Ellison syndrome. It is a disorder that is characterized by the overproduction of gastrin, a hormone that stimulates the production of acid in the stomach. So the excessive acid production can lead to formation of peptic ulcers in the stomach and in the small intestine. So it is caused by a tumor called gastrinoma that develops in the pancreas or the upper small intestine. Now let us discuss how this H. pylori bacteria can cause carcinoma. The H. pylori can cause carcinoma. The chronic inflammation that will be produced by H. pylori can lead to changes in the cell of the stomach line, which can eventually develop into cancerous cells. So that can damage the DNA of the stomach cells that can contribute to development of the cancer. So in addition to that, H. pylori can do is it can change the acidity of the stomach. So it can create an environment that is more conducive to growth of the cancer cells. So the bacteria can also produce toxins that can damage the DNA of the stomach and produce and promote the growth of cancers. Other factors, genetic, diet, lifestyle can also play role in the development of the cancer. So what was the treatment for H. pylori? It was triple antigen regimen therapy that includes clarithromycin, amoxicillin, and metronidazole. If the initial treatment fails, what will you do? A second line treatment is also available. Uh, we can use these H2 blockers or the bismuth subsilate in that case. So lifestyle changes can be avoid foods and beverages that irritate the stomach such as alcohol, caffeine and spicy or acidic food. So laboratory test, they are not the diagnostic. Rather, they can be used in the conjugation with other diagnostic method like the endoscopy. Blood test can be helpful in detecting anemia uh, in the patient with the peptic ulcers. Blood test can be used to detect the presence of H. pylori by measuring level of antibodies to the bacterium in the blood. Stool test is the choice, maybe the choice. Now, what are the treatment for the peptic ulcers we can use is antacid. How they work? They work by neutralizing the stomach acid by reducing the acidity in the stomach. So they will contain the compound containing aluminium, magnesium. So the aluminium containing antacid they will work by binding to the acid in the stomach, while magnesium containing antacid work by neutralizing the acid. H2 receptor blockers we can use is cimetidine, ranitidine, roxetidine. How they work? They work by blocking histamine receptors in the stomach that will reduce the amount of acid produced by the stomach. The proton pump inhibitor are the omeprazole, lansoprazole, pantoprazole. So they work by blocking the enzyme hydrogen potassium ATPase that is responsible for production of acid in the stomach. We can use this sucralfate. How they work? It works by forming a protective barrier over the surface of stomach lining. So that helps to protect it from damaging effect of stomach acid. Misoprostol. How they work? By increasing the production of protective mucus in the stomach and reducing the amount of acid produced by the stomach. So it is a remember misoprostol is a synthetic prostaglandin.